The next item of business is topical questions, and at question number 1, I call Liz Smith.
Thank you. To ask the Scottish Government what role the National Clinical Director has had in relation to the review process for former patients of Eljamel.
Cabinet Secretary Michael Matheson.
Presiding Officer, the National Clinical Director is not involved in the establishment of the independent clinical review. While Professor Leach is part of the same directorate as those officials, he is not one of the officials undertaking this work. Scottish Government officials are progressing the necessary work to establish both the independent clinical review and public inquiry. Once established, these will be carried out and chaired independently of both the Scottish Government and NHS Tayside.
Liz Smith.
Can I thank the Cabinet Secretary for that? The Courier newspaper is reporting this morning that Professor Jason Leach has been employed by NHS Tayside since September 2012, for which he has been receiving a Scottish Government salary under the service level agreement. But as yet, there has not been a full disclosure of exactly what Professor Leach's role has been in NHS Tayside since 2012, and whether, even on an indirect basis, there has been any activity by Professor Leach in relation to the Eljamel case. So I wonder if I can press the Cabinet Secretary to confirm that.
Cabinet Secretary.
Well, as I've just explained, he's not involved in the setting up of the independent clinical review work. As I stated, and that continues to be the case, that work is actually being taken forward by Professor Craig White and is at a very advanced stage. In relation to terms of employment, the National Clinical Director is employed on standard NHS consultant terms and conditions by NHS Tayside and works for the Scottish Government under a service level agreement. This is typical of the arrangements through which the Scottish Government can draw upon specialist knowledge from the NHS. Most of our clinical advisers working for the Scottish Government are engaged through a service level agreement or secondment from a health board in exactly the same way in which Professor Leach is.
Liz Smith.
Thank you. Just for absolute clarity, am I to understand that Professor Leach has had no input whatsoever, even on an indirect basis, with any of his staff who have been involved in the Eljamel case? Because I hope the Cabinet Secretary can understand that the most recent revelations in the COVID inquiry have obviously created very considerable concerns amongst the Eljamel former patients, who consider that it would be totally inappropriate if Professor Leach was in any way involved, even indirectly, with this process.
Cabinet Secretary.
Officer, as I've explained, Professor Leach is not directly involved in this matter. Back in September last year, both the Chief Medical Officer and the National Clinical Director agreed that the most appropriate way for its establishment to be taken forward would be for officials who already have an established understanding of the issues relating to Eljamel. And that's why the matter was passed to Professor Craig White to take forward the work to establish the independent clinical review process.
Michael Mara.
Thank you, Presiding Officer. The Cabinet Secretary is focused on the independent one-to-one reviews. Can I ask him when those will begin and, more crucially, when will they end, when will they be completed? But can he also give assurances, given the real resistance from the victims, whether Professor Leach has been involved in the establishment of the public inquiry and is offering any advice to government officials regarding that process?
Cabinet Secretary.
The public inquiry and engagement around the public inquiry again has been taken forward by Professor Craig White, and as I've previously stated in this chamber, as has the First Minister, is that work is at a very advanced stage as we've been engaging with the Lord President in order to appoint a chair for the public inquiry. Alongside that, the appointment of the individual who will be responsible for carrying out the individual clinical reviews for those patients who wish them. So I can't give you a completion date because it's down to individual patients whether they choose to participate in the programme or not. So it will be dependent on the numbers that come forward that wish to take part in that, is that both the prospective chairs have been engaging with one another to look at how the whole process will be managed collectively moving forward.
Willie Rennie.
Pictures have emerged in the Courier newspaper today of a smiling Sam Eljamel. I know this has insulted many of his victims today. Those victims are also quite angry that we're not seem to be any further forward on the public inquiry. Now, the Cabinet Secretary has indicated that an advanced stage on the individual case reviews. Is he an advanced stage on the public inquiry, and when might we get an update?
Yes, we are, as has already been stated in the chamber by the First Minister, just in the course of, I think, a question from Liz Smith the other week, where we are at a very advanced stage in appointing of a chair. As I mentioned earlier on, there's been engagement between the two prospective chairs around the clinical review and also the public inquiry, and how they will both intersect with one another, because it's important we get that right. In relation to the pictures he makes reference to, and I can understand that patients who have suffered at the hand of Eljamel will be disgusted at seeing these pictures of him continuing to practice within Libya. Of course, any decision to pursue the matter on a criminal basis would be for the police and also for the Crown Office and Procurator Fiscal Service, and it would be a matter for them to consider pursuing this individual. But clearly I can understand why people will be deeply hurt by the sign that this is an individual who continues to practice in our part of the world.
Daniel Johnson.
This case has highlighted Professor Leach's employment status as a secondee. So on that basis, can I ask, is he regarded from a management perspective as a civil servant, and is he subject to the Civil Service Code?
Cabinet Secretary.
In terms of details, I'm sorry I can't give you that information, because it's an operational matter within the civil service run for ministers. But the employment arrangements for Professor Leach are exactly the same as they are for other clinical experts that the Scottish Government bring in. Employees of the NHS who come in on a service level agreement and who undertake work in providing advice to us. In terms of how the Civil Service Code is applied, it's a matter for the Civil Service directly themselves. But of course, anyone who's undertaking civil service responsibilities, I would expect there to be an appropriate mechanism being placed for that. But that's not a matter for ministers directly.
Question number 2, Emma Harper.